उत्तर प्रदेश राज्य का राज्यपाल श्री राम भवन नायक जी, यहाँ का निर्देशक डॉक्टर राकेश कपूर जी और कार्डियोलॉजी सोसाइटी ऑफ इंडिया का प्रेसिडेंट डायरेक्टर डॉक्टर M.K. दास, ऑर्गेनाइजिंग सेक्रेटरी ऑफ द नेशनल इंटरवेंशनल काउंसिल डॉक्टर सत्येंद्र तिवारी, डॉक्टर P.K. गोयल, डॉक्टर सौमित्र कुमार, डॉक्टर श्रीनिवास कुमार, डॉक्टर आदित्य कपूर, or doctors who have come from different parts of the country and also abroad, my dear friends and brothers and sisters. The governor was asking you, chalte raho, kyun? Not because of love and affection for you, so that aap log hamara heart chalate rahe, ye uddesh hai unka. The book written by Honorable Governor is very interesting. Should move on always. मैं भारत की कार्डियोलॉजी सोसाइटी की नेशनल इंटरवेंशन का उमसिल की सालाना बैठक का उद्घाटन करते हुए प्रसन्नता अनुभव कर रहा हूँ। लखनऊ की प्रतिष्ठित संजय गांधी पोस्ट ग्रेजुएट मेडिकल सेंटर 5 से 7 अप्रैल 2019 तक चलने वाले यह बैठक कार्डियोलॉजी सोसाइटी ऑफ इंडिया के उत्तर प्रदेश विभाग के द्वारा आयोजित की जा रहा है। मुझे यह जानकर विशेष हर्ष है कि इस अवसर पर देश विदेश के विशेषज्ञ न केवल व्याख्यान देंगे और अपने अनुभव साझू करेंगे, बल्कि इस इंस्टीट्यूट सहित देश विदेश में विभिन्न स्थानों से भी वास्तविक शल्य प्रक्रिया का प्रसारण होगा। मुझे बताया गया है कि देश विदेश के लगभग 1500 विशेषज्ञ इस आयोजन में भाग ले रहे हैं, जो अपने अनुभव का लाभ साझू करेंगे। विशेष रूप में मुझे हमारा देश का गृह मंत्री श्री राजनाथ सिंह जी ने आग्रह किया, ये मेरा क्षेत्र में हो रहे कन्वेंशन, इसलिए आप जरूर आना है। तो मैंने स्वीकार किया, मगर ये कोड ऑफ कॉन्डक्ट के कारण से, इलेक्शन से कारण से खुद गृह मंत्री कार्यक्रम में नहीं आ पाया। I am delighted to inaugurate the annual meeting of the National Interventional Council of the Cardiological Society of India, which is being held here at this prestigious Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow, under the aegis of Uttar Pradesh State Chapter of the Cardiological Society of India. I am happy to know that Cardiological Society of India, right from its inception in 1948, has been tirelessly championing the cause of a healthy heart for the common Indian. It's truly noteworthy that through training, knowledge, exchange and skill development of over 5,000 cardiologists all over the country, the fraternity is working hard to create a healthy nation. Because a healthy nation can become a wealthy nation. But a wealthy nation, there is no guarantee can become a healthy nation. That's why our forefathers used to say, Arogya me Mahabhagyam. Health is wealth. I am told the society has also various specialty councils which keep track of various types of cardiovascular diseases and its treatment protocols, with the National Interventional Council being premier amongst them. I am pleased to know that the NIC focuses upon newer interventional techniques which can help a patient recuperate and get back to life faster, unlike conventional period. NIC 2019, I am told, is the annual meeting of the council. I am happy to know that the Department of Cardiology, Sanjay Gandhi Postgraduation Institute of Medical Sciences, headed by Professor P.K. Goyal, is also the organizing chairman, is one of the premier postgraduate medical research centers in the country. I am happy to see a lot of specialists coming from different parts of the country are all taking part in this conference. I'm also happy to see my personal cardiologist, Dr. Ramesh Gudupati, also among the audience, who has given me really, I can say, the second life. I'm happy to know that the meeting would include global Indian experts speaking on varied topics and performing live interventional procedures from abroad, from various centers in India, including this institute. It's truly noteworthy that the conference is set to witness participation of around 1,500 delegates from different parts of the world. I hope that the Congress would be successful in helping cardiologists. Congress, don't misunderstand, conference. to The Election Commission may take objection to this. In the healthcare sector and to give the best care to their patients at affordable rates. Esteemed members of the medical fraternity seated before me today, let me begin by congratulating you for your great service to the nation. India's health sector has achieved a number of significant milestones since independence. Post-independence, India's most noteworthy achievement in the public health arena has been increase at the birth life expectancy from around 37 years in 1951 to around 68.3 years in 2011 and 15. Although the life expectancy has increased, the rise in the non-communicable diseases is adversely affecting the quality of life. The other day, all my doctors, now of the AIMS, Aranya Medical Institute, 8 of them, they all joined together. They are all telling me, sir, the life expectancy is going to raise up to 80. Long life is good, but healthy life is required. Otherwise, long life without health will be hell. Everybody knows. So nobody would like to go to hell. Infant mortality and maternal mortality have been greatly reduced. Diseases such as smallpox, polio have been eradicated, and leprosy has been nearly eliminated. Today, the country aspires to achieve universal health coverage. We have greatly improved the penetration of healthcare services across the country, undertaken extensive health education and awareness campaigns, conducted massive sanitation drives, increased the number of government and private hospitals in India, improved immunization. We have survived a number of epidemics and we have successfully mitigated numerous public health crises. All these achievements would not have been possible in a highly populous, resource-constrained nation like India had it not been for the selfless and dedicated service done by the committed doctors and healthcare professionals such as yourself. I compliment and congratulate all of you and doctors of the country. My dear sisters and brothers, it is a matter of great concern that India is witnessing an epidemiological transition. Non-communicable diseases are on the increase. In 2017, the report of the Indian Council of Medical Research, ICMR, it has been observed that the disease burden due to communicable diseases dropped from 61% to 33% between 1990 and 2016. And in the same period, disease burden from non-communicable disease increased from 30% to 55%. This is a matter of concern. This is a deeply disturbing trend. Heart disease is reportedly killing approximately 17 million people in the world. The death rate due to cardiovascular disease in India rose by 34% from 1990 to 2016. What is even more matter of concern is the fact that 40% of the people in our country who develop heart attack are under the age of 55. It has been estimated that almost 25% of the people who die of heart attacks are less than 35 years of age. I understand that factors such as high levels of stress, increased incidence of diabetic and blood pressure aggravated by smoking, excessive consumption of alcohol and lack of exercise and lack of proper sleep contribute greatly to cardiovascular diseases. Lifestyle modification is one of the key interventions needed to prevent premature heart attacks. We have to educate the people, the government, the doctors, the media, and the public leaders. Everybody has to take lead in educating the people about going back to our original lifestyle. Our lifestyle is becoming mechanical, materialistic. This is a major area of concern. Care of the health also. But now the present lifestyle has become mechanical. You get up in the morning, get down from the bed, and then get on to dining table, get down, and then get up, get on to vehicle, scooter, car or bus or train, get on to your office and get on to table, your good chair, and then after work get down and then again go back home, get on to the dining table, eat and then get on to the bed. No physical activity at all. This is no tale of people across the country. I am talking in general terms. This has to change. There has to be a physical activity, some physical activity. I remember during my younger days, of course, to go to toilet, we used to walk half a kilometer. I am not suggesting that now. Now we have Swachha Bharat. We have toilet inside. And at least you go to toilet also, you have to bend down. Now you have a commode. To take bath, you have to bend and take water from the bucket. Now you have a shower. And to eat food also, you have to sit on a mat. Now you can sit on a dining table. No need to bend down. After eating food, we have to go out and wash our hand. Now we have a finger bowl. And somebody calls you, then you have to go and open the door. Now you have a remote. Door is open. To make a telephone call, we used to go to post office or telegraph office at a distance. Now the phone has come to your house. Even in the house also, when the telephone comes, you used to go to corner and pick up the phone. Now the phone has come to your ear and your mouth also. There is literally no physical activity at all. This is a serious problem. We all have to seriously apply our mind. Not only people in the medical side, also others also, and we have to guide our younger population. The second reason, I am talking in general terms, is about the food habits also. That's a major area of concern. Slowly, because of this advertisement and also westernization, our food habits are all changing. We are all tending to junk food, pizza, burger, stored food, junk food. And people say, sir, now food is instant. Instant food means constant disease. It has to be understood by all. How can food be instant? Food has to be cooked properly and eaten. And also it should be eaten according to the season. We were discussing with the governor today in Raj Bhavan about the food habits. Our forefathers, having lived for thousands of years, they have really given us some good practices and good systems. But unfortunately, because being carried away by this media, by advertisement, and also icons coming and then talking to you and suggesting this food is good, that food is good and all. And then we are being carried away. This is a very, very dangerous trend. It has to be reversed. I am not suggesting that you must eat this sort of food. You should not eat non-vegetarian. No. I am a strict non-vegetarian till the other day. Doctors have told me you have eaten enough for life, so reduce. So I am reducing now. Point is, you have to choose carefully the food that is required for you. And then we should not go for this instant and junk food. Children also, even the restaurants also, they also learned all these business tactics. And also they present in such a way that you go to restaurant, the names also. Name is chicken 65. The fellow's age is not even 25. He wants to eat 65. And also names are given like chicken Manchuria. We have Himalaya here. Why do you go to Manchuria, Bulgaria and Somalia? I am not able to understand. These are all simple things. These children, 2 children are sitting here. They are also laughing. I hope that the children of the country, they understand. Our food is time tested. Lucknow, you're all Lucknow, you go to Awadh biryani. What a beautiful, wonderful food. There are so many other items. Each state has something special. Each state has something special. I was just now showing to the Honorable Governor, there is a WhatsApp message about idli. There are 500 models of idli. 500 models. I was just passing on to the governor. And you can have even a idli pizza, burger, idli burger. Everything. Everything is available. That's why our food is becoming universally popular. It is becoming universally popular, but we are trying to follow Western model. That food is suited to them, their weather conditions, their temperature. But we in our country, we should educate our children, our future generation about the need to have proper, healthy food habits. You will be surprised what is this Vice President of India occupying such a constitutional position, is giving such advice. This advice is very much required for everybody across the country. You might have seen, I have been reading in the magazines also. Today also, I read one of the cardiologists, famous cardiologists, wrote in, I think, Times of India. He was also stressing on food habits, Panda, food habits. This is said world over. The incidence of cancer is also partly because of food habits. That are the findings. So we have to take care, and doctors also spend some time. That's another problem now. Patients are complaining, doctors are not spending enough time, sir. They are not even seeing the body, they are just asking for MRI scan, this scan, that scan and all. First you must understand, and you must also educate him and caution him sufficiently. Because doctors in our country are considered next to God. People have that much belief. If doctors advise, people at least try to follow it to some extent, if not fuller extent. So I urge upon all the doctors and healthcare professionals present here to give primacy to educating people about changing their sedentary lifestyles. It has been proven beyond doubt that the regular moderate intensity aerobic exercise like brisk walking, cycling, jogging and swimming for 5 days a week helps in reducing the probability of heart diseases. The world is now celebrating yoga as a means to achieve physical, mental and spiritual health and well-being. It is an excellent stress management technique and it's an effective remedy for the number of diseases, especially lifestyle-related ones. Now it's becoming popular across the globe. Again, another problem. In India, people say, sir, yoga, one boy asked me, sir, yoga is good, sir, but there is a problem. I said, what is your problem? Sir, problem is Surya Namaskara. I said, what is the problem with Surya Namaskara? He said, sir, Surya. I got it. Then I told him, if you have a problem with Surya Namaskara, do then Chandra Namaskara, no problem. Unfortunately, people try to give a communal color even to yoga also. There is no dearth of pessimist people in our country. Yoga is an ancient Indian exercise of mind and body. It is proven, one of the 64 arts of India. It is for your health. And also some people try to give it a political color. Yoga is for your body, not because of Modi. You have to understand that. I have been to Romania recently. I have been to Costa Rica. The Romanian president was telling proudly, sir, we conducted yoga, international yoga in our central hall. And the Costa Rica president, who is aged 39 years, he issued a presidential decree advising all the people to have yoga. And then during my visit to Latin American countries, I found a number of places in Peru, and also in Panama, number of places, yoga centers. That's a trend catching up worldwide. So we in India also must advise our children to do some physical exercise and also go through yoga of whatever choice they want to have it. Initiatives of the government such as Khelo India, which aspire to mold fit and healthy individuals who would create an equally healthy society and a strong nation, go a long way in promoting health and well-being of our children. We must also encourage our children to thrive on healthy food. I advise everyone, particularly the youngsters, to say no to junk food, which is causing harm to their health and affecting the quality of life. Our daily diet must include plenty of vegetables, fruits, nuts, soya products, and low-fat dairy products which are in rich proteins, have less fat, no cholesterol, and are rich in calcium and minerals. I have learned it from my own experience. India today stands poised to reap the biggest demographic dividend in history. It is one of those nations of the world with a bourgeoising youth population. 65% of the Indian population is below 35 years. It's a great demographic dividend. It's an opportunity, but also is becoming a challenge to channelize their energies. For India to achieve its dream of inclusive and sustainable development and occupy its rightful place of leadership in the world, it is imperative that its youth population brimming with potential be healthy. We must therefore invest much of our resources in prevention and early detection of disease. We must conduct massive screening drives to identify risk factors that heighten the chances of cardiovascular disease among the people and undertake measures to arrest the progress of the disease. Our primary health center should serve as bulwark in our battle against cardiovascular disease. The government of the country and the state must focus more on primary health centers, because we are in a country where even today 54% of the population live in villages. The massive urbanization, because of, the urbanization has become irreversible. You can't change it. But at the same time, you cannot ignore the rural people. They also deserve the attention of the government. Our healthcare system of primary healthcare centers, taluk hospitals and district hospitals is catering to the health requirements of rural people. The need of the hour is to provide state-of-the-art healthcare facilities in the rural and remote areas, as most of the modern hospitals are located in urban areas. Our efforts are also being hampered by factors such as the rapidly growing population, vast country and diverse terrain, local prejudices, superstitions and illiteracy also. While successive governments at the national and state level have been according highest priority to the health sector, the private sector needs to supplement the efforts of the government, especially in bridging the urban-rural divide. The private sector would work with the spirit of altruism, commitment and missionary zeal in providing modern and affordable healthcare facilities in the rural areas. See, politics, health, education, they used to be treated as a mission. Of late, some people are trying to convert them into commission, giving them some remission to values and also doing some omission to their duty. This should not happen. This is still marginal. We should arrest this trend. And I have seen number of doctors who are wedded their life to the cause of the welfare of the people, morning to evening, working only for the welfare of the patients. That means you are working for the welfare of the country. And thereby you deserve that satisfaction and happiness. That satisfaction and happiness. Service gives you happiness. Service beyond office hours gives you much more happiness. My grandfather told me, service as part of your service because of your profession or your occupation or your employment gives you satisfaction. But service beyond that gives you more satisfaction. He said, by doing service, normal course, as part of your responsibility, you will get ananda. If you do beyond your duty, then it will give you mahadananda, maha-ananda, utmost happiness. I have been enjoying it also. I have been enjoying it, taking part in certain voluntary organizations, conducting medical camps, attending the medical camps, even as vice president, even as a central minister. I used to go to rural areas, spend time along with others, and then involve doctors to serve beyond their call of the duty. That should be the approach for each and every individual. I encourage all the medical students, I interact with them to render service for at least, I suggest to them that they should, I have been going around to various universities and people are all clapping for all my speeches, but when I say that you must work at least 3 years minimum in rural area before getting your first promotion, there is silence. I understand. But you must understand that the country is huge. 54% of the people are still depending on agriculture. Agriculture is our basic culture. We have to preserve that culture because we need to have food security. These people who are in the rural area, they are working hard. That's why we have food security. A country like India's size, we must have homegrown food security. You cannot depend on imported food security. You are not Dubai or Singapore, where everything is imported and you get everything fresh. But India's size, we need homegrown food security. So we have to take care of the people who are working on agriculture and allied activities and focus our attention in the rural areas also. The primary health centers are the first point of contact with patients. A robust, responsive and well-equipped network of the primary health centers can greatly reduce the burden on secondary and tertiary healthcare institutions by focusing on disease prevention and early detection and treatment. My dear sisters and brothers, we must not falter in our to communicable disease either. We must also strive to fortify our response towards medical emergencies and further strengthen our readiness to combat breakout of epidemics such as the recent Nipah virus outbreaks witnessed in Kerala. We would also have to prepare ourselves to deal with a number of mutated versions of microorganisms resistant to antibiotics and drugs that would arise due to changing climate and unprecedented levels of pollution. India must also invest much more resources in research and development to keep pushing the frontiers of knowledge and keep evolving new and improved protocols for treatment of diseases. It is not sufficient to prolong the lifespan of an individual. The years of life added must also have quality and must be fulfilling. For this to happen, we must keep exploring the unexplored and be brave enough to venture into the new fields of medical sciences. Science and technology are breaking barriers and conquering new heights all over the world. India must not miss it. We have an inherent knowledge. This land, this water, this air, it has got something special. Dhanvantari, Charaka, Samhita, Susruta, those days, and there was not much technology and much science and all. And even you look at the international scenario where multinational companies are headed by Indians. I need not give the examples. A lot of people, they are all headed because of the knowledge and intelligence that is available. If you put it to proper use and research and science, the ultimate aim is the betterment of the conditions of the people. That is the purpose of the science and research. So we should not miss out on that. There are unimaginable advancements being made in medical science. Cutting-edge research in disruptive technologies such as cybernetics and artificial intelligence, including machine learning and augmented reality, are altering the paradigms of medical science. I would like to urge doctors and medical professionals to always resolutely follow the Hippocratic Oath and the principles of medical ethics. We must constantly strive to improve our health sector along three vectors: quality, accessibility, and affordability. India is already known as the pharmacy to the world because of its good quality, affordable drugs. Everywhere there is demand for Indian drugs now. Our pharmaceutical sector is doing very well. Although our healthcare services are among the cheapest in the world, some of the life-saving drugs and procedures are still beyond the reach of the common man. All the stakeholders in the health sector need to work in synergy to ensure that healthcare is affordable and accessible to common man. India must also stand out and serve as a model for quality, affordable healthcare for other nations to emulate. I think when I was in Malawi, there in Africa, I saw that day's newspaper headline is that a famous artist of that country is being flown to India for a transplantation. So that is the attraction. Now India is becoming a healthcare destination and also a healthcare tourism hub. So that being the case, people who are all engaged in that profession, they must try to excel. We have already introduced the health insurance scheme, the largest in the world, that's benefiting lakhs of patients. However, the need of the hour is to ensure universal health coverage in letter and spirit. We cannot rest until we secure the health of the last malnourished child and cure the last tuberculosis patient. The task at hand is by no means an easy one, but I have full faith in the capabilities of Indian healthcare professionals. Let me once again congratulate the Cardiological Society of India for considering this 2008. This interventional council, this is for cardiology. I hope in the future there will be an interventional council for mind also. Thank you very much. Namaskar. Jai Hind.
Ladies and gentlemen, those were the pearls of wisdom being shared by the Honorable Vice President of India,